There are 150,000 non-trauma related major amputations in the United States every year. The vast majority of them are patients with diabetes and peripheral artery disease. We are in a fight against unnecessary amputation. Clinicians specializing in the treatment of these diseases are often faced with having to tell patients that there are no further options for therapy and they have to undergo a major amputation. We can do better. Rising rates of diabetes, obesity, heart disease, hypertension are not news. These are the new normal. But what may be news to many people is that the high number of patients suffering from these diseases today means that in the future there will be a tsunami of patients at risk of major lower limb amputation. To put it into context, more patients die within the first 5 years of a CLTI diagnosis than with many of the most well-known cancers. So given these facts, it's easy to see why CLTI is a public healthcare crisis, but it just doesn't affect patients and the healthcare system. It affects families and caregivers and the entire community. We should do better. Unfortunately, CLTI continues to disproportionately impact underserved populations, including the African American, Hispanic, and Native American communities, where sometimes amputation is just seen as part of life amongst the elderly. In fact, African Americans face double the risk for major amputation. And we know many of the reasons why. It's a question of access to care, access to screening, and patient awareness. And shockingly, 73% of patients do not get an angiogram and 54% do not get an intervention to restore blood flow before major amputation. Too often, by the time the patient goes to the emergency room, it's too late. The doctor will have to tell the patient that there are no more options. They will lose their limb. We can do better. The LimFlow technology may be the best shot we have at preventing unnecessary amputation. In some patients, the arteries cannot be reopened or reconstructed. But what we can do is reroute the blood flow to where it's needed most. The work we do at LimFlow is designed to help patients in their greatest hour of need. The LimFlow system is designed to give physicians the tools they need to reroute oxygenated blood through the existing venous system into the foot, helping relieve the symptoms of CLTI, heal wounds, and ultimately save the limb. In the fight against amputation, LimFlow is developing a new therapy for patients who are out of options. But that's just the start. We need to do better, and we can do better. We're committed to patients, physicians, to innovation, and to our mission: no limb left behind. Join us at limflow.com.